Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And we're back, and we are just getting our first conversation for this morning started. And as we said before the break, we are bringing you our COVID-19 update, and we are going to be talking a bit about the current situation in Belize. And joining us for this conversation, we have Dr. Laura Friesen, who is a general practitioner at the Belize Medical Associates. Good morning, doctor.
Good morning. It's nice to be here this morning, bright and early with friendly faces.
It's definitely nice to have you. Thank you for joining us. And so, given the recent numbers, we've been seeing an increase in cases as well as deaths. And can we just start with sort of what your reaction is as being a medical practitioner from seeing what the current numbers are in Belize?
Well, it definitely causes concern. We have been through one wave already. That was pretty bad, and we saw effects on the community level, individual cases that I can name off the top of my head. We saw the country, what it went through, the healthcare system, and it's reality. It's a reality we have to face, even though maybe we do not want to face it. But it does seem that we are going into a bit of a crisis again, and also looking at how other countries, how their numbers have gone. So it would be unreal to think it wouldn't happen to us. And so I think for right now, the message is just, what can we do to stay as safe as possible, and how can we prevent people from getting very sick and dying?
And I was just going to say, so just to ask very quickly, in your experience, let's just say day to day, have you also been seeing those that reflected as well in your work? Have you seen perhaps greater cases coming in, or greater cases of concern, I should say?
Yes, for sure. We have seen the jump, especially here in Belize City where I practice. We have had a huge explosion of cases over the last 2 weeks. We have seen cases where I work at the clinic, or respiratory cases have been increasing over the last few weeks. And so it's definitely something that we see reflected on our clinical practice. We also have patients coming in telling us about their family members who are sick as well. So we do see the effects of it starting to happen in the community. They're not asymptomatic cases. Many of them are symptomatic, and some of them have been getting sick. So that is definitely something that we have been seeing.
Dr. Friesen, yesterday's report that came out, we saw the largest number of new positive cases detected in Belize City. You work at the BMA NHI clinic in Belize City, and so you have patients coming in on a day-to-day basis. Do you feel that there is the same level of awareness and sensitivity and precaution being taken from the patients that you're seeing?
Compared to?
When we weren't in this particular wave. Like, is it less or more than last year?
I feel like persons are just now starting to react. I feel everyone was kind of a bit complacent, maybe I should say. Even myself, over the last few months, everyone wants to go back to normal. Everyone wants to get back that human contact. And so it's a little bit hard to balance the need for human contact with the need for safety. And so I do feel that there has been some complacency in the general public and people I come in contact with. But I think now we are seeing some persons start to become more conscious again of where we're going. It's always hard because as doctors or as people who study public health, we look into the future predictions. So we see these things coming on, and the general population might not see them coming on until it's happening to them, to their own family. And so a lot of times we might be talking and talking and talking, and someone else might not see that risk as we do, because we focus on the medical side of things, on the clinical side of things, and we have seen how bad things can get. And so it's a little bit of a play with risk. How do we interpret risk? That's one of the main things as well with vaccine hesitancy. What is my interpretation of risk of catching COVID-19 virus and what is my risk for actually suffering the consequences of COVID-19 compared to what are the risks of taking the vaccine. So that's a lot of, those numbers have to be analyzed, and they are being analyzed by doctors and scientists, and I look at those numbers as well to best educate my patients as to what is your risk of getting the consequences of COVID-19 and catching it versus what is your risk of getting the vaccine. And so far it's been far on the side of getting the vaccine, especially for our older population and our population with any kind of comorbidity, and that includes obesity as well.
Tell us a bit about your experience with people who are vaccine hesitant at the clinic.
Well, I try to explain and give information.
Do you see them?
Oh, they come in all the time, but I am very encouraged because many of them come with questions.
Okay.
Many of them come for a general checkup. We have identified new diabetics, new hypertensives. People are coming in, they're asking for a checkup. People want to be healthy, and that is encouraging for me. Because they are coming in and asking questions. But one of the main things that I try to explain is we would all love to go to a world that doesn't have COVID-19, especially as a doctor. I would love that. But right now it doesn't seem that's going to happen in the near future. So what are our two options? Well, there's three options. You go live as a hermit in the bush and not have any contact with any person for the next probably 4 to 5 years. That's option number one. The other two options for normal people would be, number one, you get the vaccine, you take the risk of getting the vaccine, but also the protection that comes with it. Number two, you don't get the vaccine, that's option number three, actually. You don't get the vaccine, but then you also have the risk of the virus, of catching the virus and the side effects. And we have seen now with the rapid spread of cases and the probable presence of Delta in the country, even though we don't have confirmation of that at this time, is that everyone is going to be in contact at some point in time. It would be illogical to think otherwise. So this is your choice, right? You want to take the risk of getting the vaccine, you get the protection. You want to take the risk of getting the virus. We have a poor healthcare system. It's often overwhelmed. It gets overcrowded very quickly. You want to take that risk. That is also, you can also choose that risk, but that is a much higher risk for you at this time, especially seeing the explosion of cases.
And what are some of the concerns that people have about getting the vaccine? Because you say they come in and they want to be healthy. Someone going to a clinic means they want to protect their health.
Yeah.
So why is it that they find it difficult to be convinced to take the vaccination?
I think there's a lot of misinformation out there. There's a lot of persons that are sharing information maybe for the excitement that it causes and not necessarily for the veracity of the information. That is unfortunate. I think even as doctors, we should not motivate by fear, but rather by information and by caring for the population. So that is a big thing. Facebook videos, YouTube, there's a lot of misinformation. A lot of persons look at statistics, manipulate them, and say them with fancy words so people don't know that they are not speaking the truth. And especially our elderly population doesn't really have that access and that savviness with technology to actually go and look for real information themselves. And so they're relying on their neighbor and the WhatsApp video that someone sent them, and these might not always be good sources or true sources. And so that is one big thing. Of course, there's always the whole thing with the risk. The media has run away with some of these blood clots at certain points in time. There is a risk. They have identified a risk of certain types of blood clot. They remain very rare, but it is there, and I inform all of my patients of that. Actually, if the whole country, I crunched some numbers last night because I was getting ready, and if the whole country of Belize would get vaccinated, I counted a population of 400,000 persons. You would have, at the most, with the current statistics, and these come out of Europe because Europe has used the AstraZeneca the most, we might have 2, at the most 4 cases in the whole country if 400,000 people would get vaccinated. Wow. of a blood clot, and not all of these end in death. So these can be treated, right? That's not a lot if you look at it at a population level. Your risk of any kind of thrombosis having symptomatic or asymptomatic COVID is up to 25%. And so if you get COVID, even if it's asymptomatic, you have a much higher chance of blood clot at any point in time than you ever get. At this point, the data is showing that you would have any risk from the vaccine. Also, contraceptives have a high risk of blood clot. We have many patients on them, and the risk for blood clots with contraceptives is actually higher than the vaccine. So it's all about how do you interpret risk. A lot of times we don't understand how to interpret risk, so therefore we can't understand the information that is given.
Yeah, and I think you speak of the side effects, the potential side effects of the vaccines, and it's important that we say it. It's important that we help people understand that, yes, everything that we put into our body can have potential side effects. And it doesn't mean you're going to get it, but it means that you may.
Yeah.
Now, the other issue I wanted to talk about was looking at the variants. And you have been very vocal online. We know you've been trying to get education out to as many people as possible to help all of us understand just what's happening with the different variants. Let's talk about those. What we know about the variants of concern so far.
Okay, so there are, by now, I think there's probably about 7 to 10 variants of concern. I'm not an epidemiologist, so I will just explain in simple terms. It's one of the first variants that was identified was Alpha, which was coming from England, which was identified first in England. And then that kind of gave them, I think it was their second or their third wave. And then that was, I think, around the end of the year last year, and then beginning of this year we had the huge wave in India, and that's where Delta was first identified. Now if we just want to bring it into focus, the original COVID-19 virus that was responsible for the first wave in most countries had a certain level of transmissibility, and that means how easy it is spread from one person to the next. And when we looked at Alpha, which was the kind of the first major variant that was, responsible for the first major outbreak, that one showed around 50% increase of transmissibility, meaning that it spreads much faster, much easier, and Delta is now 40 to 60% more transmissible than Alpha. So it's basically 100% more transmissible than the original variants, meaning that your risk of getting infected from another infected person, like let's say you're sick and I'm sitting here, me getting sick from you would basically, my chance is 100% more if you would have Delta than if you would have the original variant. So that means it spreads much faster in workplaces, much faster in homes. The viral load is actually I'm trying to remember the exact number, 100 to 1,000 times higher in Delta patients, even asymptomatic. However, the vaccine does reduce that drastically, even if you have a breakthrough infection. So that is another reason to get the vaccine, because it reduces your viral load and makes you less infectious, majorly less infectious to other people.
And Gamma is the one that originated in Brazil that can affect children.
Well, all of them can affect children. But yes, Brazil had a particularly unfortunate wave. I think this was, I'm trying to remember which month, but they had actually at one point in time, their average age of persons in the ICU was around 40. Which is, if you think about it, that's a major thing, because in the initial wave, mostly 70, 80, and 90-year-olds were dying. And to have the average age of an ICU being around 40, that is major, because that means half of your people are under 40 and the other ones are over. So they went through a particularity that had social and political factors as well, not just the variant. So we cannot always compare exactly what happens from one country to the next, but it is something to be, careful about, and to make sure that we are doing the best we can for our own health so that we can avoid those types of situations.
And I think earlier you had said that that Delta is probably here by now. And is that based on what you've seen in terms of the clinical, or just based on what you had also said earlier about your the assessment of risk based on the numbers and stuff that you're seeing?
Well, I mean, I'm saying that, like I said, I don't have the proof of that, but U.S. has 80% Delta cases right now, so I think it would be rather naive of us to think that that hasn't by now traveled to Belize. And we have seen a pretty explosive spread where whole households and whole workplaces end up, you know, with positive tests because it spreads so quickly. So we're seeing it both in the epidemiological trends and just knowing that the U.S., which is one of our closest neighbors, and there's a lot of traffic up and down, it would kind of be, you know, naive of us to think that we haven't at least have some cases of Delta in the country. And because it's much more transmissible, it is very likely to have already become the dominant variant in the country.
So, you know, when we had the first wave of COVID-19 in the country, and even the second, when we were, I guess, battling the original COVID virus, there were some guidelines that were given to us, and I know they were used for contact tracing as well. One of them being, how long were you without a mask from another person who was also unmasked? And I know there was a criteria, I think it was 15 minutes of exposure. With
cumulative.
Yeah, cumulative. So it was like if it was 5 minutes, 5 minutes, 5 minutes. Now, with the high transmissibility of Delta, what are some of the new precautions we need to be taking as we interact socially with others?
Okay. Well, there again, this has to do with the amount of vaccinated individuals as well. So one thing, the 15 minutes, it's kind of arbitrary number. It was just as a guideline for, you know, how do we break it down to people to kind of explain to them that, that a time of exposure is equal to risk of infection. So that 15 minutes is definitely not quite like that anymore. We have seen people that get infected just with being in the same room, just passing through, or having touched someone, or you know, having had one face-to-face contact and then leaving. So because of the high viral load of the Delta variant, and so this is something that we have to adjust. I think as we get more vaccinated individuals, hopefully it doesn't mean we have to even be more socially isolated, because it does have mental and, you know, psychological effects as well. And so I think just as a precaution, keep wearing your mask, look at your surroundings, make sure your surroundings are well ventilated, make sure that you're cleaning your hands. Hand washing is a major thing. Make sure that you're not going into crowds. Crowds tend to be quite dangerous. I have mentioned in my post, workplaces with their lunchrooms are the best place to get COVID-19 because no one's wearing a mask and everyone's touching their face and their food. And so it's you know, it's all about your risk factors and what risks you are willing to take and put yourself and your family in, right? So that's basically
the CDC in the United States earlier this week advised that in states where there were a high spread of COVID-19, that in fact people should resume mask wearing indoors.
Well, I mean, that is, like I said, that has to do with epidemiological control. Like, how do you control an outbreak? Remember that with the Delta virus, we have the vaccine efficacy is slightly less than original. It's still very high. 60% risk reduction for symptomatic infections, and over 90% risk reduction for severe and illness and death. So we're still very, very effective vaccines. However, we do have this, so if it reduces your risk by 60% for symptomatic infection, you can still have those people that are the breakthrough infections, that are the ones that get either asymptomatic or mildly symptomatic cases. And so if you have too many of those, and with Delta being much more transmissible, you could end up with a huge outbreak on your hands because of the explosiveness of this. And that is, I imagine, why they went to that again, because many of the states had already kind of, you know, laid down the whole mask thing for right now. But it has to do with risk factors for each population. Again, we can't compare the US and Canada with Belize. They have ICUs. They have a lot of resources in the country. For me, if my mother gets sick, what do I do? Do I have money for her to go to a private hospital? Do I want her to go to a public hospital? Are there spaces in the public hospital? These are all things I as a doctor think about, and sometimes we don't think about them until we get sick. Yeah. And so there's a little bit of difference as well. That for me has a big thing with the risk as well. US and Canada, they have a lot more resources. Their countries are larger. They have bigger economies. They tend to be able to handle surges better than we do because of just our level of resources in the country, basically. So that's something to be, concerned about as well, and something that hopefully we can learn from this pandemic, that we can start to strengthen that system more and allocate more resources to health, both on an individual level and on a country level, right? Because it's important as an individual as well. Everyone has that opportunity in their own life to be more healthy and to exercise and to have a healthy diet, which will help them, whatever happens.
What's the type of interaction that people who are, like if your family is vaccinated, how do you interact with them?
So one thing that has not changed, maybe I should start with that, is that if there's anyone with flu symptoms or fever, they should not be in any public place. It doesn't matter if the fresh cold, the wali allergy, that I get wet last night, it doesn't matter. If you're sneezing and coughing and have sore throat and fever, you stay at home and you stay isolated, because that is one thing that people have been kind of getting a little, I've noticed people getting a little bit more lax about.
That is so true. Yeah.
Oh, I just had wali flu, or oh, I just get wet last night. And that's
allergies, which have been really bad. I'm guilty, yeah.
Well, if you know your body well, you can usually tell when it's an allergy and when it starts to get infectious. Yeah. But that is something that I really feel the need to highlight. Vaccinated or unvaccinated, we should be conscious of our infectiousness, because even other respiratory viruses are very super infectious. So it doesn't really matter, be it COVID or flu, why should you be spreading it around to your family and friends? That's one thing. The other thing is, once the members of the family are vaccinated that are at risk or that have more exposure to other persons, I would say that some of the guidelines could be relaxed a little bit, depending on what your original ones were. Yeah. But I still advocate for ventilated spaces, good hand washing practices. They should be part of our life. It doesn't matter, be it COVID or not. Washing your hands saves you from a world of ills. It's not just, we're not just preventing COVID here, we're preventing, parasitism and all kinds of other viruses that we can get through food and through contact with other people. And so, official guidelines, I'm not sure about that, and I guess it has to do with with what is your risk and what is, and also who are your family members. If you have very high-risk family members, your behavior should be different. For example, if you have cancer patients, people in your family that are cancer patients or that are elderly over 70, you should continue to be careful, because they could still get sick. Even
if they're vaccinated. So if I have an elderly mom and she's vaccinated and she's in the household, she may stay home and be isolated, but everyone else goes to work. So you still have to have that level of precaution, like we did back in March and April last year.
I would say if everyone is vaccinated as well, then there is a lower risk. Yeah. Like if all of your family members that come into the house are also vaccinated, because the vaccination does decrease your viral load if you would get infected, and it does reduce your risk of getting infected. So it does very much decrease your risk. Of course, there will always be those outlier cases. Yeah. There will always be, and we can't really
be the exception to the rules.
Yeah. But to stay sane, I think once we have the family vaccinated, I think that we can start to decrease a little bit on those.
You said something, and I think we really should take the opportunity to explain it. Last year, we were looking for things like loss of taste and smell and fever. Those were kind of the first signs for, and we were actually told things like runny nose and sneezing probably wasn't COVID. Yeah. But that's changed now, right?
Yeah. This information actually comes from, I believe it's an app that was just collecting data, population-wide data in Europe and in England while they were dealing with their Delta wave. And they noticed that people were more reporting headache and runny nose, and body ache and fatigue before they were actually reporting fever, loss of taste, and cough. And so this is important. Why? Because this means that, I mean, in the beginning, especially when we weren't even sure what we were dealing with, the major, information campaign was, if you have fever and a cough, then you stay home.
Yeah.
It wasn't even if you have fever or a cough. If it was if you have fever and a cough, then you could be infected. And that has changed now, where a lot of our mildly symptomatic patients have symptoms that would favor a flu much more than before. So before it was more like, oh, you probably have a flu, but you have like a dry hacking cough with a fever, so you're COVID-19. You have that diagnosis. But now it's more of, okay, anybody with the flu symptoms could potentially be COVID-19, or might probably be at this point, especially in Belize City. But that is something to remember, and also just realizing that if you have risk, or if you have had exposure to COVID-19, then it is probably COVID-19 if you start with symptoms. And so it's important to be quick with your testing. Doctors work better with facts. We want to know what we're treating. We can treat you better. We don't do very well with guessing. We want to know what's happening. That's why we do tests. That's why we examine you. That's why we ask you to come in if there's a problem, because these things help us to save lives. They're not just fun for us to swab people. It actually saves lives.
And percentage-wise, one of the things that I had wanted to ask earlier when we were talking about variants is that when we look at symptomatic versus asymptomatic cases, do those numbers still look sort of the same to when we were just starting to sort of learn about the pandemic? Because if I recall correctly, we were looking at numbers that the asymptomatic cases were significantly higher than the symptomatic cases.
I would not be able to make a very informed statement about that, especially because right now we have the variable of vaccinations in there, and so that has definitely increased the amount of mildly symptomatic people. For example, in England, they were dealing, or are dealing still, with a huge wave again of Delta, but by now their mortality and severe hospitalization is very low compared to what it was in their initial wave. And so there will be data coming up in the next couple of months that will bring into the picture those kinds of variables. But I couldn't say right now what is the exact percentage. But we still see on a worldwide level, that is reported cases and reported deaths, which we often know are very far from the actual deaths and actual cases. That the mortality rate is still around 1%, which is 10 times higher than for normal influenza. So it still hasn't kind of budged from there, even throughout the whole pandemic so far, but maybe with vaccines, hopefully, and with improved treatment and more awareness, that will start to go down with time. That is our goal, for that to start to go down, that 1%, right?
Yeah, and that's such a key point that we don't talk about very often. Our mortality rate in Belize is higher than the global average of 1%.
Yeah, well, that might be one of the reasons might be because we have not always been ahead of the game with our testing. So many of our mildly symptomatic and asymptomatic cases might not have been detected. And also it has to do with our resources on a hospital level for the cases that do get severe. Is there enough oxygen? Is there enough ventilators? Are there enough healthcare workers? Because that has been an issue as well. You can't just have 6 people on ventilators just sitting on the beach. You have to have nurses that are taking care of all of them. And if we don't have that level of, that amount of nurses to give those persons the care that they need, then of course we start to run into problems, right? And so I think that might be part of it. But there's definitely many different factors.
I think you said it earlier, and I think it's perhaps a perspective we haven't looked at. Do you want to risk taking the vaccine, or do you want to risk trusting whatever is available in our healthcare system? Private if you can afford it. And I don't know if people know how costly it can be. Private care for COVID can run you into the hundreds of thousands of dollars. And whether there is space available in the public health system.
Yeah. Because there was a moment in the last wave that we had, October, November, December, where public and private hospitals were pretty much at capacity or over. And so that, with a new variant that spreads faster, that is always a blink away. You know, it's always something that we pay attention to.
How do you, in the clinic, address I mean, when you talk about symptoms like a runny nose or a sniffle, we're going into the rainy season, people get sick very easily. So I would very easily dismiss a runny nose as my allergies, or maybe I caught a cold. How do you, when people come in, do you automatically assume it's COVID-19?
No, we always look at all the risk factors. We also look into social factors. For example, is this person going back into a workplace with many colleagues? That makes my level of suspicion, or not suspicion, but that makes me much more careful. If this is, you know, someone who stays at home, I might say, well, let's monitor you for 2 or 3 days, and if you have no elderly around you and you will not leave your house, then we can monitor you and see if you develop any further symptoms. But we do a lot of risk evaluation. That's why being a doctor is not so easy sometimes. We look at every individual case and we see what are the social factors, what are the biological factors, is this person at high risk for complications. And you know what, testing is not such a big deal. It's better to know that you're negative than to be walking around and wondering, was I, you know, am I spreading it to my neighbors? Am I spreading it to my mom? You know, I want to encourage people to come to the clinic if they feel like they have any symptoms, and not wait and just say, oh, well, I'll go to work for 5 days with a sore throat, and then you come in and you're like, you were at work for 5 days already with a sore throat and fever? Like, what? Like, come on, like, you should have been at the clinic on the first day. Why? First of all, you get tested faster, so you know if you need to be on any treatment. Second of all, if you're going to be going to work sick, you're going to stay sick longer. And so the employer loses, you lose. You're miserable at work for 5 days because your body needs rest to recover, and it's not getting the rest. Be it COVID, or be it a flu, or be it a runny nose or a common cold, whatever it is, sometimes taking 1 or 2 days off is prevention for everybody. It helps you get better because you rest. It helps your employer because you're back at work faster, and it helps your colleagues because you're not spreading them anything, be it whatever respiratory infection there might be around at the workplace, right? So that's just, you know, my encouragement as a doctor. I always encourage my patients, come in early, take a couple days off, take care of yourself, drink lots of fluids, and get tested, and then we can move on with life.
Yeah. Let's talk about the breakthrough infections and what we know so far. I know of people, even here in Belize, that have been vaccinated and test positive. And there are two levels. There's first dose and then getting positive, and then the second dose and getting positive. What do we know so far?
So the first dose doesn't really provide you with a lot of protection. It's around 30%. The AstraZeneca seems to have a bit of a slow effect where it takes a few weeks for your immune system to get going. So one dose is about 30% protection, which is something, but it's minimal if you're talking about being in a workplace with, 50 people, or, or going to a social event, or going to places where, safety measures are not in place. So for anyone who has had one vaccine, basically act like you don't have any. That would be my advice. And then once you have your second vaccine, the maximum efficacy is 2 weeks after. And so you should still maintain maximum precautions up to 2 weeks after your second dose. And even then, as long as we have surging virus in the country, the surging virus, everyone is at risk again. And that's why we want people to get vaccinated, because we want to get out of that surge. Once we get out of that surge, your risk of a breakthrough infection will also decrease greatly, because there won't be as much exposure around you. So in general, we're looking at, yes, individual risk reduction, but we're looking at population risk reduction, because it's not just, what will it do to me if I get it, but how many people are getting it that increases your risk.
Now, if I'm fully vaccinated, I am fully vaccinated, and I come in contact with someone with COVID, I know one of the reasons some people say they won't take the vaccine is that, oh, well, you can still get COVID even if you're vaccinated. What's the difference for me and the likelihood that I get symptomatic or severe COVID-19?
Well, that's numbers we were talking about. Again, you have 60% less chance of getting symptomatic COVID and 92%.
If I'm exposed, I'll most likely get it?
No, you still have 60% reduction of actually getting any kind of symptomatic infection.
Okay.
Okay, so you would have 60% reduction of risk. So this doesn't mean 60% of people will get COVID and 60% of people will not get COVID and 40% will. This is talking about risk reduction for an individual. So 60% risk reduction for symptomatic as a fully vaccinated person.
Okay.
Even if it's Delta. This is already Delta numbers. Okay, with the other variants, it's actually a little higher. I mean, with the original one, it's actually a little higher. And 92% reduction of risk for hospitalization or death, or severe COVID, in other words. And so there is a major reduction in risk. Of course, there is still some risk.
Yes.
But it's quite a bit less than where we started off in the beginning of the pandemic, and quite a bit less than even where we were at the beginning of this year.
So if I get exposed to a person with COVID-19, I may get some of the symptoms, but I'm most likely not going to end up in the hospital.
That's right.
Okay.
That's right.
Now, we do have some questions coming in from our viewers. One person wants to know if they can donate blood after they've been vaccinated.
Yes, I actually have donated blood myself already.
Okay.
There is not a contraindication. I believe the blood bank is asking for you to be, I want to say 2 weeks, but don't quote me on this. So they are asking you to give a little bit of space between your last vaccine and your blood donation. But for sure, you can donate blood after you got the vaccine. That does not change anything in the structure of your blood.
Yeah, and you should give blood anyway, because we always need it.
There we go.
Yeah.
Yes, encourage everyone to give blood.
Yeah.
Yep.
And the concern for children is one that we don't get to talk about enough. We know there's only one vaccine approved for children so far, Pfizer, which we may get, and the Minister of Health is saying that they may roll out with children. But how much should you be protecting your children? Because originally we used to consider them to be safe. Their body was resilient to the COVID-19.
There is still, the risk for children is still actually quite low. Sorry. The risk for children is still actually quite low. There is, of course, some, and the new variants that do seem to have been affecting a little bit more the younger persons. But the general risk is still low, but this is again where the whole population risk comes in. If the whole country has Delta, has COVID at the same time, there are gonna be sick children. There are gonna be a couple that end up in the hospital and maybe end up in the ICU. That's just inevitable. But if the surge can be controlled, then as soon as the level of infection in the population goes down, the level of risk for children also majorly goes down, because their risk of death and severe illness is much lower than, for example, someone who's 50 years old. So it tends to go up really exponentially after like 50. Like after 50, the risk of death and severe COVID goes up. Like with each age range, it goes up kind of very, very quickly. And so there is still, I still, like I said, be careful with all symptomatic infections. Schools hopefully will put into place some safety measures if they are able to go back into classroom now in August, and I hope they will. But the risk for children is low. It is there, but it is quite low, and so it's all about balancing that out with population risk as well. So I'm not an epidemiologist, but I'm just trying to explain a little bit about your question.
Yeah. And just, on a personal level, as a frontline worker, what is it like for you seeing the cases surge here in Belize City, hearing the vaccine hesitation, knowing some communities are completely being unsafe? What is it like for you on a personal level?
It's a little frustrating. I think I also have COVID fatigue. I'm just tired of this. I want this thing to be over. But at the same time, have learned, or am trying to learn, to be patient and give information as much as possible, because I believe that if people are able to understand, they will make a good choice for their health. And so I think a lot of times it's cultural factors, social factors, it's misinformation that is preventing people from making a choice for their health. So personally, it's of course something that I do feel concerned about, and that's why I do try to educate as much as I can.
Yeah.
It can get frustrating, I will say that much.
You've lost patients.
Yes, I have. We have lost patients at the clinic, and we have, I have lost, family members have lost loved ones. There have been many cases of loss over the last year, and sometimes it's frustrating to see people not recognizing the loss of someone else, and that strikes me as particularly cold. I will always grieve the loss of someone, even if I did not agree with that person, or even if I don't understand what happened. But some persons seem to be diminishing the losses of people who have lost loved ones to COVID, and that is what I think personally is hurtful and damaging to our society.
We have another question here, and this is asking about lactating moms, if they should get the vaccine.
There is no contraindication to lactating mothers to get the vaccine. So if you're breastfeeding, you should be able to get the vaccine. There haven't been any evidence of side effects in the child. And so that is something that I would encourage you to do, especially if you're working or in a situation where you do have risk, or live in a household with higher risk family members.
Yeah. Now, let's just close out for me. My final question is looking at treating COVID-19 at home. If someone does get COVID-19 and they have mild symptoms, is it as what we saw before, where you have to be closely monitoring your symptoms because it can take a turn for the worse very quickly?
Well, that all depends on your comorbidities and what's your level of general health. Yes, you should be monitoring your symptoms. I mean, you don't have to be checking yourself with a thermometer every 15 minutes, but it's good to have a thermometer in the house. If you do start with more severe symptoms, it's good to have a pulse oximeter in the house. It's good to get your checkup at your local clinic, so that they can check you and make sure that there's not signs of any, early signs of any complications. Of course, the paying attention to what's happening in your body is something, as a doctor, that I always advocate for. A lot of people don't pay attention to what's happening in their own body, and so that's something that I really advocate for, because I want people to make healthier choices in general, not just with COVID-19. I want them to realize what they're eating and how much they're exercising and what kind of lifestyle choices they're making that are actually bringing them to the point where they have higher risk for COVID-19. That's also, that's important as well.
Yeah. If you don't mind, if we could take just 5 minutes to answer some of our viewers' questions.
Okay.
And just tell us, and this one, it'd be good if we address it. It says, burning question, it has been noticed that metal continues to stick on people's body, apparently after the vaccine has been administered. Can you comment on that?
Yes, I will comment on that. So I'm not a physicist.
Yes.
So I actually had this discussion with a couple family members a couple days ago who had studied math and those topics in university, and I asked them, would it be biologically possible for a human body to be magnetized in that manner? And this person was of the opinion that you would basically your temperature would have to be like 1,000 degrees Celsius for you to actually attain that level of magnetism. So it's not physiologically possible. I mean, don't quote me on this, because I really don't have the physics background. Maybe we can get a physicist, on the show. But those videos are most likely manufactured. There's no way that could physically happen to a human body. For them to turn magnetic. I mean, everything has a certain level of magnetism because of just the atoms and the relationship between the electrons and the nucleus. But for that level of magnetism, that would not be possible.
And there's a difference between magnetized and just a sticky body. Like if you're sweaty.
That's right. Yeah. That's the other thing as well. Yeah.
Okay, and is it...
There is a question that we have if there are any long-term side effects of the vaccine.
Well, there is, okay, so to address long-term side effects, of course, there is a lot to be studied because this vaccine is about a year old now. Mm-hmm. There is something that we call pharmacovigilance, which is actually the following up of any medication or any medical product post-market or post-use in a population. And so all of the countries that are putting vaccines, especially Europe, they are doing close follow-up of any reports of side effects long-term so far, and they regularly update and analyze all these reports to figure out, is there actually a link or is there not, or what's the risk factor. And so there is not any proof or any biological mechanism for some of the fears people might have so far. And we do know that COVID can have very bad long-term side effects. I mean, you can die, and that's pretty long-term, if you ask me. And so it's all about risk, you know, which risks are you planning to take? And we don't need to only talk about death with COVID. We have patients that have long-term consequences such as stroke, heart attack, thrombosis, because remember, COVID has a high risk of thrombosis, lung damage. There's going to be an epidemic of lung problems in about 10 to 15 years because of all the patients that got lung damage now during COVID-19 but survived but still had the side effects. So we definitely know that COVID-19 has very, very severe and very widely spread long-term side effects. And so when I look at that compared to what we know so far about the vaccine and how safe it appears to be so far, for me, there's no black and white answer. It's about your risk.
Mm-hmm. How long should I wait after being 1 month after delivering my baby? I guess how long after delivering can I get vaccinated?
Yeah, you can get vaccinated pretty much right after.
Okay.
Yeah. I mean, if you're not going to be going back to work, I would probably suggest that maybe you wait a month or so just so that your body is a little bit more, recovered or a little stronger. Mm-hmm. But there's not a counterindication in as far as that.
All right. And my son is 13 years old and is asthmatic. Is it safe for him to get the vaccine when it is offered to children?
I cannot really comment on individual cases, and it would be good for them to consult their family practitioner. Mm-hmm. But of course, the Pfizer one is the one who has undergone the trials, and that's still the safety safety information on that is still coming out and still developing. So that will remain to be seen once it is available and based on advice from the personal family doctor.
Yeah. What's the most common question you get asked by your patients?
I think just is it safe for me? And like I said, we do have many people coming in and asking for checkups, and I'm very encouraged by that because it gives us a chance to address other health issues, not just vaccine or no vaccine, but you come and you get a checkup. That's great because we can look at you, we can see, well, you have these risk factors, this is things that you need to change in your lifestyle, and so that is very helpful. But that is a very common concern for many people, and rightly so. We all even if we don't realize it, we all do risk analysis all day long, every day, in every part of our life with everything that we do. And so it's a part of life, and the more information we can get, the better of a decision we can make.
And just looking at the question of, I'm sorry, I lost my question there for a second, but we were talking about vaccine safety, and the question that people have about whether or not, oh my God, it's gone. Yeah.
Well, I was just going to ask because you know, as we're running out of time, I just looking at the numbers that we're seeing right now of infections and whatever. I just wanted to sort of round off the discussion by maybe some of what are your predictions as to you know, increases or whatever we might be seeing over the next couple months, and what would be the or perhaps we can say what would be the best case and the worst case scenario based on the numbers that we're seeing right now.
Well, again, I'm not the epidemiologist, but you know, right now it can go either way. If we're really lucky and our RO stays, you know, under 1, this wave might be over possibly by September. But if things continue like they are going right now, this could still be exponentially higher than we're seeing right now. And we're starting to see better response for vaccination, but these are mostly first doses. And so these people are not really protected. So as I also mentioned on my Facebook post, is that you can't really vaccinate yourself out of a surge. The vaccinations happening now are hopefully going to prevent mortality and severe COVID in the following wave, as in after this one. But this one, it's kind of already on us. It's kind of already happening. And so we do encourage people to be careful and to be mindful of the fact that the healthcare system doesn't take much to be overwhelmed. It sucks to be poor in Belize, and it sucks to be sick, and it sucks to be sick and poor, and many of us do not have the resources to deal with the kind of consequences that we might face if we're not careful. And so that is just a little bit of a sobering reality that we should keep in mind, and try every day to reduce our risks as much as we can.
I remember my question just very quickly. Masks, the proper masks. I know that some help to protect you better than others. What's your advice?
For general public, if the majority or all of the persons are wearing masks, the basic medical mask it gives you a good level of protection, or even the cotton cloth one, because basically what you're doing is you're preventing the expulsion of virus as much as you need. Now, of course, for medical professionals, we do prefer the KN95 or the N95s, because they do protect you if you are in an environment with high viral exposure. So as long as we have good ventilation, we are not going into huge crowds, and we're not touching up on, you know, a lot of people, and the majority or all of the persons are wearing the simple mask, that does seem to give a high level of protection. So there's not really a need to be running out and, you know, mask buying, you know, the expensive masks, but it does have to do with what environment you're going into. If you're going into an environment where there are confirmed COVID cases, or you're going into an environment where nobody is wearing a mask and where there's very poor ventilation, then of course you might want to step up your risk, your protection level, and wear a mask that's a little bit more, that it gives you a little more protection.
Well, thank you for coming in and taking your education campaign from Facebook to here on TV. But we appreciate it. I think everybody wants factual information, and they want people who can help us understand more about what we're battling with this pandemic.
Yeah.
Thank you. We're going to go ahead now and take a break, and when we come back, we'll be talking about the updating of the National Marine Habitat Map. So please stay tuned.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.